There is of course the good, the bad and the ugly in the world, but the South Indian shall focus today on turning the ugly into good. We are going to have a very frank and open conversation about the C word, that is COVID. It's around, but why is it that I feel we are kind of blasé about it? I'm going to turn to camera 1 again and I'm going to show you what we are talking about. Look at that, ladies and gentlemen, that's what we are going to talk about, slaying COVID in 2024. So, let us come back to the story that I said that I feel that we are blasé about it. To not panic is of course good, but to be complacent is kind of foolish, I feel. It's like we want to brush it under the carpet, but the South Indian won't. We shall talk about it and defeat it. So, first about the situation regarding the new subvariant JN.1. A total of 197 cases of COVID-19 subvariant JN.1 has been detected so far, and the new addition to the list being the state of Odisha. If we talk about the overall situation, according to the Indian SARS-CoV-2 Genomics Consortium or INSA-CoG, then of course 10 states and union territories have so far confirmed the presence of the JN.1 subvariant, and the pecking order looks something like this. Right on top, Kerala with 83 cases, Goa comes next with 51, Gujarat is at third place with 34, Karnataka 8 cases, Maharashtra 7 cases, Rajasthan 5, Tamil Nadu 4, Telangana 2, Odisha like I said earlier 1, and the national capital Delhi at 1. Insofar as COVID-19 cases are concerned, India has recorded 636 new infections and thereabouts, while the active cases stand at 4,394 according to the data released by the Health Ministry on Monday, and 2 deaths have been reported according to the latest data.
Today we had conducted a meeting of all the institutes which are coming under the medical education department to test the preparedness of the hospitals, because the number of cases are rising. So we have asked all the directors and the medical superintendent to be prepared, and we have also instructed them to set aside some around 50 beds in each institute, and even some ICU beds are also available. We had called a meeting to check the preparedness.
Any major decision taken?
No, decision is now, you see, people need not worry, because this variant of Omicron, JN.1 is not so, it doesn't cause a severe disease. So, people need not panic on this. The only thing is, people who are above 60 years and who are comorbid, they need to take some precaution, they need to wear the mask.
I am sure scientists and doctors know their job. I am not here to teach them that. When I say that, I quote the WHO, which has classified JN.1 as a separate variant of interest given its rapidly increasing spread, but it also said that it poses a low global public health risk. Okay, that sounds like great news, but then the number of daily COVID-19 cases had dropped to double digits until the 5th of December last year, but then the cases went up after the emergence of JN.1. Also, JN.1 cases continue to be reported not only from multiple states, but also several other countries. If we talk about at home, what's the situation so far as this is concerned? Last week in Karnataka, there were 922 fresh cases, which is, of course, it went up. There is a threefold increase. This figure that I read, which is 922, is an increase from 309. which was recorded the previous week. So, increase happens. In Maharashtra, cases increased from 103 to 620, which is a whopping 6-fold. I mean, this is absolutely whopping, I feel. The center has asked the states and union territories to maintain a constant vigil, because there has been an uptick in the number of COVID-19 cases. But you and I, the people of India or Bharat, whatever you want to call it, we need solid, definitive solutions and self-discipline to overcome this new subvariant this new year. Let me now introduce you to the experts, perhaps, who can actually explode all the myths so far as JN.1 subvariant is concerned. We shall be joined by several guests, but as of now, Dr. Anita Ramesh, Professor of Medical Oncology, Apollo Hospital, Chennai, is joining us, and also Dr. Sunila Garg, who is member Lancet Commission on COVID-19 and Professor of Excellence, Chair, Program Advisory Committee, National Institute of Health and Family Welfare. A very warm welcome to both of you. Great to see you, Dr. Anita. It's been a long time, and also Dr. Garg, wonderful to see you. I like a women's panel, you know. I've always wanted more women on my show. I'm so happy you guys are here, and that too, you know, in the new year. So, first is, see, I want to, like I read in my introduction, both of you are doctors. You know, I just want to, Dr. Ramesh and Dr. Garg, want to bring to your notice, somewhere I feel we are being very blase about it. It's like, it's all right, it's okay. I know to you doctors always say do not panic, do not panic, but the point is we can't brush it under the carpet, and I will talk about anomalies. Number one, Dr. Ramesh, doctors are now saying, whether it's in Telangana, particularly in Kerala, also in Karnataka, they are saying, look, if you have persistent fever, you should go get tested. You and I, we've all lived through a period where a slight cough and would say, please go get tested. Yeah, you never know. We all got tested. I have got tested at least 11 times since the time COVID broke, because one had symptoms. So, Dr. Ramesh, how do you ascertain that someone who shows symptoms of fever, cough and cold should immediately go for a test?
No. The thing is that if you're getting fever, cough, cold, chills, body pain, we tell the person to isolate themselves. Okay, isolate, keep yourself away from work, keep yourself away from everybody, and confine yourself to the house. Yes, 24 hours, 48 hours, maximum 72 hours, we tell them. Paracetamol is the only drug you should take at that time. Do not panic, do not rush, nothing to do. But during this 72 hours, if your condition deteriorates, if your fever becomes very high, if you are become very tired, fatigued, sleepy, okay, you feel weak, but then immediately rush for medical care. After 72 hours, fever did not subside, or say another couple of hours. If you have not subsided, then visit the doctor. And once you reach the hospital, the doctor takes up all the things and might do a testing. So yes, answering to your question, do not rush and do the test immediately. It may be a non-specific viral infection. But yes, a persistent fever, rise of temperature, and tiredness, weakness, coughs, throat, body pain, wait, give a time for 72 hours, provided you don't deteriorate, go to the hospital, and the doctor takes a call whether the testing has to be done or not.
All right, Dr. Garg, would you like to take that question? First is, I want to bring to your notice the larger question. It's a perception, and it's not just my perception, and any kind of perception, experts have to actually explode that myth. Are we being rather light-hearted about this? Are we saying this shall go away? I know, like I'll repeat myself, ladies and gents, I don't want to create panic, paranoia, neurosis here, but there is a limit to it. In the new year, we need to get real. Would you agree, Dr. Garg?
I think, basically, I like to say that, COVID had never gone out of our lives. That is one thing. Once, the virus is amongst us, it is bound to, kind of, depending on the situation, because the virus, once it is there, it's going to multiply. And it is also undergoing mutation as well, once it is there. So, this is something which has happened, the mutation in spike protein. So, and this was also accidentally detected during the genome sequences. So what I would like to say at this point of time, we need not panic, but we need to be vigilant. That is one thing which is very important. And that's where, when Dr. Anita was pointing out that we need to be, kind of looking at, we need not be paranoid ki ek din ka fever hua and we just go and get ourselves tested. But we need to see that, we need to isolate ourselves and watch for the symptoms. But at the same time, it is important that the system's preparedness is there along with the home preparedness. What I say is that when people are, should behave responsibly, and they should say that if they are, feeling the symptoms of COVID, which was already pointed out in terms of high grade fever, is this time, persistent cough is also one of the symptoms, along with severe body ache and all that. So that is where, we need to be, educated about the whole problem, and then similarly isolating ourselves. But plus, it's the system preparedness which is very, very important. And again, we need to also follow, the norm of, mask or social distancing, which we were practicing earlier. And most important is our hand hygiene. And particularly when elderlies are at home, we need to be much more vigilant, because, if elderlies are there, then are also comorbid. That means either diabetes,
Yeah, but
hypertension, cardiovascular diseases. We need to
yeah.
look at that part
Yeah,
also.
but Doctor, Rajiv, let's say welcome Rajiv Jaydevan, Dr. Rajiv Jaydevan, co-chairperson, IMA COVID Task Force and former president, IMA Kochi in Kerala. Rajiv, very, very warm welcome to you. Rajiv, somehow, whatever you are all saying and you will say right now, there is a feeling that we've forgotten that. We are being very blasé about it. You know, hand hygiene, like Dr. Garg just now said, even before that, Dr. Ramesh said, look, if your fever persists for 72 hours, please go and see. There is body chill and everything. But I get a general feeling, and I am not saying this because in Delhi the cases have increased. We just are taking it very light-hearted fashion. In the new year, we need to slay this. We need to show the same kind of fixity of purpose that we as a nation showed. Do you think that we are being slightly lax about it? Is it genuine, this laxity, or you think we need to kind of go back to being vigilant, Rajiv?
As Dr. Garg said, COVID never went away. That is for the world of science. But for the general public, for the regular person who's not a medical doctor, they don't see the effects of COVID anymore, at least the overt effects, things like deaths in large numbers, hospitals being overburdened, lack of oxygen, things like that. So from the common man standpoint, it is somewhat expected that they will have a lax attitude about this. So it is the duty of healthcare professionals like myself, Dr. Garg, and responsible media personalities like yourself to let them know the truth and the facts without causing panic. And that is exactly what you said in the beginning of this program.